Skin needling basics. Prior to performing the skin needling procedure, ensure you have completed the following: consultation, signed consent form, Skin Fitzpatrick assessment, and photo documentation. Pre-treatment setup. To correctly prepare your station for the skin needling treatment, you will need the following: topical anesthetic, foaming cleanser and alcohol swabs, disposable cloths and gloves, basic dressing pack, saline, chlorhexidine, vitamin B serum or similar, a skin needling device, a biohazard waste container, and sharps container. Patient preparation. The dermal therapist must thoroughly wash their hands and apply appropriate gloves before commencing the procedure. Using a foaming cleanser, perform a double cleanse to remove any residual makeup, sunscreen, and cutaneous oils. Followed by a firm alcohol rub to ensure effective penetration of the topical anesthetic. Once the skin is clean and dry, apply a generous layer of topical anesthetic to the proposed treatment area. The dermal therapist will now demonstrate the application process. Using an occlusive material, such as cling wrap, if indicated for your particular topical anesthetic, this is to prevent evaporation of the cream, which significantly enhances its efficacy. However, occlusion is not indicated for all topical anesthetics, so always refer to the instructions on the tube before use. When using topical anesthetic, it is important you are aware of the limitations to the application area. The face, neck, and décolletage are appropriate size areas, whereas application to the legs from the ankles to the thigh could potentially result in too much systemic absorption. You must also monitor the patient's skin response to ensure no skin reaction is occurring, especially if this is the first time you have used a topical anesthetic on the patient's skin. Station preparation. Every clinic will have slight variations when it comes to skin needling treatments. Skin needling is not always conducted as a fully sterile procedure. However, when working with blood, it is the responsibility of the dermal therapist to provide a clean environment and follow infection control guidelines at all times. The dermal therapist in this demonstration is using a basic sterile dressing pack and sterile disposable needle tip to perform the skin needling treatment. Please take note of the workflow used throughout the procedure. The skin needling procedure. After the topical anesthetic has been on the patient's skin for approximately 30 to 40 minutes, or as per manufacturer's instructions, prepare by washing your hands and applying 2 pairs of examination gloves or 1 pair of surgical gloves. This provides additional protection from needle stick injuries. Commence the treatment by removing the occlusive cover and the topical from the patient's forehead using dry gauze. Thoroughly wipe the area with chlorhexidine. The dermal therapist will now apply a layer of vitamin B serum to the area to be treated. Please note, serum is used to provide slip and to avoid the needles catching on the skin. Some clinics will offer factor 4 or PRP treatments in conjunction with skin needling. The advantage of using a skin needling pen is you can adjust the needle depth from 0.2 mils to 2.5 mils with ease to customize the procedure to suit the patient's skin and the area to be treated. When using the pen, pressure is not required and will not enhance the treatment efficacy. Note that the dermal therapist is following a 4-way cross-hatching technique using a 1mm needle and will assess the patient's skin before proceeding with the remainder of the face. The skin needling treatment works by creating microscopic injury to the blood vessel that causes the release of cytokines and growth factors, which results in collagenesis. Once the blood has been wiped away using a dampened gauze with saline, mild to moderate erythema remains and petechiae is desirable. If the topical anesthetic has been applied correctly, the client should not have been experiencing discomfort, only a slight vibration from the handheld device. After completing the forehead, the dermal therapist will follow the same technique on the remainder of the face. The lower face has more subcutaneous tissue, so it is recommended that the dermal therapist adjusts the needle depth accordingly. We will now leave you to watch the remainder of the treatment. Please pay special attention to the dermal therapist's cross-hatching technique and expected skin response, such as mild to moderate erythema and pinpoint bleeding. Once you have completed the treatment, all residual blood should be wiped away using gauze from the dressing pack and saline. For this patient, moderate erythema is evident. However, for some patients, only mild erythema will be achieved. Erythema will last for approximately 24 to 48 hours. Thereafter, a mild exfoliation may occur for 2 to 5 days. Once finishing the treatment, dispose of the needle in the sharps container to prevent needle stick injury. Pile all dirty gauze in the middle of the dressing pack and roll up into a small bundle. Discard waste into the biohazard bin. Aftercare post-skin needling. On completion of the skin needling treatment, apply a layer of the serum used in the procedure, or if the patient will have UV exposure, consider applying a mineral SPF. The patient will be curious to see their skin. Hand the patient a mirror, reassuring them of the normal and expected side effects. To close the procedure, discuss the main points listed in the written aftercare instructions and provide the patient with a copy of this. Cleaning and sterilizing post-skin needling. Wipe down the skin needling device and all surfaces with 70% isopropyl alcohol.